What if your body was low on oxygen and you didn't even know it? That's one reason why healthcare providers rely on pulse oximeters. They can detect low oxygen levels, sometimes before you feel symptoms. Let's take a closer look at this powerful little tool. A pulse oximeter is a device that clips to your fingertip and measures your blood oxygen saturation. That's the percentage of red blood cells in your bloodstream that are carrying oxygen. How? It shines light through your skin and measures how the light is absorbed. If your body absorbs more infrared light, it's a sign your blood has lots of oxygen. If it absorbs more red light, it could mean your blood doesn't have as much oxygen as it should. For most healthy people, blood oxygen levels should be between 95% and 100%. If it drops below 90%, it could be a sign that your body isn't getting enough oxygen. Oxygen is essential to every organ in your body. Your brain, heart, and muscles all need a steady supply to work properly. Low oxygen levels can be a sign of serious problems, like lung conditions, heart conditions, viral infections, and blood clots. Healthcare providers use pulse oximeters to monitor your health. Your provider may recommend you get one for home if you have a chronic lung condition like COPD, if you are recovering from a serious respiratory illness, if you use oxygen therapy and need to track your levels, or if you are being monitored for a heart condition. A pulse oximeter is a useful tool, but it's not perfect. Always consider how you feel. Even if your oxygen number looks normal, call a healthcare provider if you are short of breath, feel dizzy, or have chest pain.